Oh, hi, it's Ogochi Wachuku.
Yes.
I've got an appointment with the nurse this morning.
Yes, I can see you here. Okay, please take a seat. Joe will be with you as soon as he's
I'm Ogochi, and quite recently I found out I've got cancer. I mean, what a shock. It still doesn't feel real, if I'm honest. I'm going to have treatment, which is a combination of chemotherapy with immunotherapy. That's a bit of a mouthful, really. Chemotherapy with immunotherapy.
I'm Joe, one of the nurses who'll be looking after Ugochi during her upcoming treatment. I know she's anxious. Who wouldn't be? I'm going to do my very best to answer all Ugochi's questions and help put her mind at ease. So, let me start by saying that chemotherapy and immunotherapy are just words that mean medications, or drugs as we tend to say. Our bodies are made up of cells, like tiny building blocks, that replace themselves as they wear out. Cancer happens when a single cell goes wrong and keeps copying itself in an uncontrolled way. Chemotherapy drugs are a range of medications used to destroy the cancer. They can stop the cancer from spreading or reduce the chances of cancer coming back. Whilst doing this, they still have effects on other healthy cells in our body. That's why you may experience side effects from treatment. Now, immunotherapy works in a slightly different way by helping the body's immune system to recognize and attack cancer cells. We give chemotherapy and immunotherapy together in a two-armed approach. The chemotherapy arm is destroying the cancer directly, while the immunotherapy arm is using the immune system to fight the cancer, both at the same time. This approach can enhance the effectiveness of both types of treatments and maximizes the effects on cancer cells. Is that okay so far, Ugochi? All making sense?
Yes, I'm following you.
Now, the treatment is given to you as an outpatient in one of our cancer treatment day units, so you don't stay overnight in hospital. We have cancer treatment day units at Finchley Memorial Hospital, Chase Farm Hospital, North Middlesex University Hospital, and at the Royal Free Hospital. We take a lot of care to ensure that the day unit is calm and organised, and that you are comfortable and well looked after.
Oh, okay. So I'll be there a long time.
Well, it's different for everyone, anything from 30 minutes to several hours. Every treatment is prepared especially for you by the pharmacy team, according to a specific prescription, and this can take some time. Your treatment is delivered to the unit in advance of your treatment time.
Oh, so my treatment is individually made for me. And how do you get the treatment? I mean, like, how does it actually enter my body? Is it tablets that I swallow, or do you give me injections?
Good question, Ugochi. Your treatment will be administered by specialist nurses who are trained to handle the chemotherapy and immunotherapy medications and give them to you safely. The most common way to give chemotherapy and immunotherapy is through a drip in your arm, so the drugs can enter your bloodstream directly. We call this an infusion. Some immunotherapy and chemotherapy medications are given as an injection under the skin. When we do give medications through a drip, it shouldn't hurt. Sometimes your arm can feel a little cold, but you shouldn't experience any discomfort at all. If you do, you should tell the nurse who's looking after you.
Okay. Can I choose whether I have my chemotherapy with immunotherapy as tablets, or injections or infusions?
I'm afraid not, Ugochi. The chemotherapies and immunotherapies come in different formulations, so you may end up having, say, some as an injection and an infusion, for example. Let me tell you about the steps patients follow through treatment, or the pathway, as we call it. Before each treatment, you'll have a blood test, and also an appointment with one of the clinical team. This might be face-to-face in the clinic, or by telephone or video. The clinician will ask about any side effects you've had, and they'll check that your blood test shows that you're fit to have the next treatment. They may make some changes to your treatment to help lessen any side effects that have been bothering you. Now, a couple of days after that appointment, you'll have your treatments in one of our units.
So I don't have everything on one day? The blood test, the review appointment and the treatment, I mean.
No, it isn't possible to do everything in one day. But people soon get into the routine of having their appointment and a blood test, and then a couple of days later, going to the treatment unit for the next treatment. It's the same pattern each time. When you come for your very first treatment, we'll give you a treatment record book, and we'll write all your appointment dates in it, so it's a bit like a diary. The book also has your treatment details in it, and there's space for you to write down any side effects or questions that you may want to ask the doctor or nurse.
Okay, that's a good idea.
When you first start treatment, we will also give you a small alert card which has the Acute Oncology Helpline phone number on it. There's somebody available to help 24 hours per day, 7 days per week. But if the line is busy, please keep trying. The nurse who answers the phone will ask questions and tell you whether you need to attend the hospital, either to clinic or to go to A&E, and give other advice. This helpline number isn't for general questions, it's just for if you feel unwell.
Okay, Joe.
The alert card is important, so you'll want to keep it safe. I'd suggest taking a photo of it and saving the photo on your phone or copying down the number. That way, if you do need to call the 24-hour number, you won't need to spend time looking for the card. I want to talk to you now about side effects, Yugochi. Chemotherapy and immunotherapy can both cause a range of side effects. Some are common and others are less common. But you must remember that everybody is different and has a different experience when it comes to side effects. The side effects can sound like a lot, but we can treat them and make them more manageable, just as long as you tell us about them.
I'm listening, Joe.
The thing to remember is that treatments damage cancer cells, but they also have effects on the rest of your body, the healthy parts. I'm going to tell you about the immunotherapy side of things first, and then I'll talk about the chemotherapy side of things, if that's okay.
Yes, of course.
Because immunotherapy targets your immune system, it can cause too much inflammation in different parts of the body, leading to symptoms like watery, runny poo, skin rashes, a cough, joint pain, or hormone changes. These can happen at any time during treatment. Less often, it can happen even months after you finish treatment. It's really important that you tell us about any new or unusual changes immediately. We'll also be looking out for changes in your blood tests. We'll check some of your hormone levels and look at how your kidneys and liver are functioning. This will help us to pick up on any worrying changes. But if you develop any new symptoms such as those we've mentioned, rashes, noticeable joint pains, you must tell us. And if you have any new pain, frequent watery poo, breathlessness, feeling very out of breath, or feel very sleepy and tired during the day, you should call the 24-hour contact number.
Goodness me, that's a lot to take in.
I know, Yugochi, but do remember these are not all common side effects. The main message is if you don't feel well in any way, or if you develop new symptoms, do call the 24-hour support line. It can help to know what's normal for you and to keep a record of how you feel on different days. But trust your instincts, and if something doesn't feel right, just call us.
Okay.
With the chemotherapy side of things, there are lots of possible side effects, depending on which individual medications we're giving. I'm not going to talk about all the potential side effects, because your clinical team will tell you about those. But I'll just tell you more generally about chemotherapy side effects now. Chemotherapy causes white blood cell numbers in the body to reduce, so your natural resistance to infection is reduced. And this is really important. If you get a high temperature above 37.5 degrees, or fevers, shivers, shakes, or just generally feel unwell, you must call the helpline. And if it's over 38 degrees, you should come straight to the accident and emergency department. Do not delay.
Oh, okay. I will, of course.
If you don't already have a thermometer at home, it's a good idea to get one. You don't need to take your temperature unless you feel hot or cold or unwell.
I do have one somewhere, but I'll make sure I keep it handy once I start treatment.
A lot of people are anxious about being sick while receiving chemotherapy.
I was going to ask about that.
Well, some chemotherapy drugs can make people feel very sick, but others much less so, or not at all. We'll give you tablets to take before treatment and to take home to prevent this, called anti-sickness tablets. Immunotherapy rarely makes people actually sick. A small number of people do experience a bit of nausea. feeling like you want to be sick though. If you go home after treatment and start being sick, you should call the helpline, the 24-hour helpline number that's on the alert card.
Okay, Joe, I've got the message about the 24-hour helpline number and how important it is to use it, and use it quickly. What about my hair? Will it fall out?
Immunotherapy doesn't tend to make hair fall out. There are a few specific chemotherapy medications that cause total hair loss, but apart from those, the changes that you might notice would be your hair becoming thin or dry or more fragile. If your hair is likely to fall out, your doctor will warn you beforehand and arrange for a wig. There's plenty of advice and support to help you cope with any changes to hair, and these are usually only temporary changes. Just ask one of the clinical team.
Okay, that's definitely good to know.
You may also notice that your skin becomes drier or discoloured. Some drugs do cause rashes or other specific skin and nail changes. For skincare, we recommend a mild moisturiser to keep your skin hydrated, but above all, sunscreen.
Wear sunscreen. Got it.
Like immunotherapy, chemotherapy can also affect your tummy and cause runny, watery poo, or make you feel bunged up, like constipated. Chemotherapy can also affect your taste. Sometimes your appetite can make your gums feel sensitive or sore. To help with the sore mouth, you can rinse with salt water a few times a day, and we can give you special mouthwashes. It's a really good idea to use a soft toothbrush during treatment. And it's a good idea also to get any routine dental work completed before you start chemotherapy, if you can get an appointment with your dentist in time. But if you do need to see a dentist, you must let them know that you're having chemotherapy and immunotherapy. They'll want to know some details of your treatment.
There's a lot to watch out for, isn't there?
You're right, Yugochi, and it's our job to do that. We can manage and reduce most chemotherapy and immunotherapy side effects, but in some cases, we can't completely resolve the effects from treatment, or it can take a long time. We treat a lot of inflammatory side effects from immunotherapy with steroids. Steroids can make blood sugars rise, so we have to manage that carefully. If you are known to be diabetic, we need to be extra careful.
Okay. Do you recommend any special sort of diet?
No, we don't. A healthy, varied diet is good, but eating what you fancy and grazing is good too. If you find it difficult to maintain your weight, your doctor or nurse may refer you to a dietitian for some advice.
What about herbal medicine? I take some capsules to help with my well-being. Are those okay?
Well, it's important that you tell your doctor or nurse about all medication you're taking before you start treatment, including any herbal remedies or supplements, as not all medications are compatible.
And alcohol? Is it safe for me to have a glass of wine?
Yes, it is. A glass of wine isn't a problem. It's probably best avoided on the days you're actually having treatment, though.
Okay, that's good to know.
Feeling tired or fatigue is a very common side effect of most chemotherapy and immunotherapy drugs, and can often increase over time.
Increase? Oh, that's a shame.
Right, it can help to keep a record of how you feel on different days, because you might notice a pattern and can plan around it. There's lots of help and advice on coping with tiredness. Just ask us if it becomes an issue for you. And do accept help from family and friends who are looking out for you.
What about exercise? I enjoy going to the gym.
Oh, that's good to hear. We do encourage everybody to remain as active as possible. You can continue any regular exercise. You may need to modify it if you feel tired. Any movement is good, Yugochi, and that includes walking.
And what about work? What do other people usually do?
Well, it's a personal decision whether you choose to continue working during treatment. You can talk this through with your doctor or nurse, and also ask your boss about flexible working. Not just days off for the actual treatment, but maybe going part-time or doing fewer shifts. That's all I wanted to say on side effects for now, unless you had a question.
So do I just turn up to the unit on the designated day?
Yes, you'll be given a time to attend. Okay, let's talk about your actual treatment appointment now. First, you'll be taken to a chair and made comfortable. We want you to bring along a book, or you can listen to music or podcasts with headphones. Oh, and we have volunteer massage therapists who attend the units and offer hand and foot massages some days. There's tea, coffee and snacks, and we'll give you lunch, but you can bring your own food and drink if you prefer. You might spend longer in the unit on the first day, as the nurses will explain a few things to you and some drugs are given over a longer time period for the first treatment.
Will I be okay to drive myself to and from the treatment?
Okay, on the very first day, we'd advise you not to drive yourself up to the unit, just in case any of the medications we give you make you feel sleepy. You can then make an informed decision about transport for any later appointments. Do you have any other questions, Yugochi?
I don't think so. You've told me a lot today. Oh, actually, yes I do. Can I bring my partner with me when I have treatments?
It's fine for somebody to come with you, Yugochi, but they may not be able to sit in the room where you have treatment because there's limited space. Your partner can wait in the reception area or head out and then come back at the end of treatment when you're ready to go home. Anything else you'd like to ask?
It's a bit personal, but can I ask about sex and intimacy? Is it okay to still have sex whilst on treatment?
Of course you can ask. It's fine to have intercourse, but you will need to use barrier contraception like a condom. It's important not to get pregnant whilst you're on treatment, and often for a period of time after you finish. Your doctor can give you more specific advice. A condom will also protect your partner from being exposed to any of the drugs whilst they could still be active in certain body fluids.
Alright, and is it okay to have a short break away? We already have a holiday planned, but can we still go?
Usually, yes, for short holidays, but just run this by your doctor or nurse because your treatment does need to be regular. Anything else you'd like to ask?
Not at the moment, but I expect I will think of things later. Thank you, Joe.
Don't be afraid to ask your doctor or nurse any questions. No question is too small. We also have Macmillan information and support centres at our hospitals, and the staff there are good with hints and tips on coping with cancer treatment side effects at home. They've even made some practical hints and tips videos about side effects that you can watch on the Roll Free website. The link to the webpage is in the description of this video below.
I will definitely pay them a visit, and if I get these side effects, I'll remember the videos.
I hope Yugochi's starting to feel more confident. It's natural to be nervous before the first treatment, but nobody goes through this alone. There's a whole team of us right here to look after her during her treatment.
Well, I understand a lot more about my treatment now, but I won't lie, it's still very daunting. Joe has talked about a lot of side effects today. I really hope I won't get many of them, or any of them if that's not too much to ask. I suppose once I actually start treatment, it will make more sense. For now, I'm off to grab my notebook and pen so I can write down some more questions to ask next time. Perhaps you'd like to fetch your notebook and do the same. Or maybe it's just been a lot to take in, and you'd like to go through all of this again. Feel free to rewind, rewatch, and repeat as many times as you'd like. You can also share the link with family and friends. I hope this information has reassured you, and I hope your treatment goes well.